Alright, welcome back everybody. This is going to be our third lesson in our series of lessons covering ECG and EKG rhythm interpretation. And in this lesson, we're going to take a dive into arrhythmias. Alright, welcome back everybody. Like I said, this is going to be our third lesson in this series of lessons. And for this third lesson, we're going to really start to take a dive and take a look at the different types of arrhythmias that you're going to find your patient in. For those of you who don't know, my name is Eddie Watson, and I'm going to be your presenter for this lesson. But before we begin here, if this is your first time visiting this channel, and you're interested in seeing more critical care educational content such as this video, then please do subscribe down below. Make sure when you do that you hit that bell icon and select all notifications. That way you'll be notified as soon as our lessons become available. Your support truly does mean a lot to us, and it really helps support this channel as well as videos like this. And so for that, we truly want to thank you. So like I said, this lesson is going to be all about covering the different types of arrhythmias that you can find your patient in. We're going to go through all of these, show you examples of them, as well as kind of talk through sort of what some of those causes are, what some of those key characteristics or key features of that arrhythmia in order to help you identify it are. And hopefully with what we've discussed in the past two lessons, you'll be able to take that knowledge and kind of understand some of the conduction issues or the issues that are going on underlying some of these rhythms that you see. So I have listed out here some of the major types, and there's going to be multiple arrhythmias within some of these categories. But the major types that you see here, first we have our sinus arrhythmias. From there, we're going to go on and talk about the different types of premature beats that you're going to see. Following that up with talking about some of the bradycardic and tachycardic rhythms that you're going to see. From there, we're going to do a breakdown of either our atrial dysfunctions, our junctional rhythms, or some of our ventricular problems. And so finally, the last type of arrhythmias that you guys are going to see are what are called our heart blocks. And in fact, our next lesson is going to be a dedicated video just to those heart blocks. But I did want to list them out here as they are categorized as one of the major types. And so as you can see over here on the diagram of the heart on the right, there's really a lot of question about what area is causing the problem and where the dysfunction is that's leading to these different types of arrhythmias. So hopefully by the end of this lesson, you'll have a better understanding not only of what's going on behind each arrhythmia, but being able to more importantly identify them so that you can possibly intervene if need be. Now before we begin, you guys head down into the comments. We'd love to hear which of these types of arrhythmias you're most interested in hearing about. Alright, and with that out of the way, let's go ahead and start off with our first one here. And for this, I'm going to bring back our 6-second strip paper that we have here, and I'm going to put up an example of each of these different types of rhythms for you to be able to see it, and we'll kind of talk through, like I said, some of the ways that you can identify this particular arrhythmia. Up at the top, you'll notice our tick marks or our hash marks in order to identify the time breaks on here. So we have the two big hashes and the one small hash in the middle. Therefore, we know that this strip that we're looking at is a 6-second strip. And so the first of these arrhythmias that we're going to talk about is our sinus arrhythmia. Now, there really are multiple different types of sinus arrhythmias that kind of fit in this category, but we're going to, just for the purpose of simplicity, we're just going to talk about this generalized encompassing category. And so really to start off, when we say that this is a sinus arrhythmia, it's because this is actually originating in the SA node. And again, going back to part 2 in this series, which I will link to up above, we talk about how to distinguish a normal sinus rhythm. And the reason that we know that this originates in the SA node is because we have our P waves right here. And along with that, we've got a pretty narrow QRS complex, which are our two big key indicators that this is a sinus beat and it's originating from that SA node. And in fact, if we count out our rhythm here using the 6-second method, again, we talked about that in the previous lesson, we see that we have 1, 2, 3, 4, 5, 6 beats here, and therefore we can estimate our patient's heart rate to be 60 beats per minute. Now, the reason we refer to this as a sinus arrhythmia is all on its own, it actually has an increasing and decreasing heart rate, which hopefully should be pretty obvious. As you can see, our distance between these two beats compared to the distance between these two beats is quite a bit different. And again, it goes back and we have a shorter or quicker time between our beats here. And so really our heart rate is just speeding up and slowing down, and it's doing this all on its own. And fortunately, this is often a benign thing. And so really to break this down, if we have a sinus beat or a rhythm that's based off signals that are coming out of the SA node, but we don't have that consistent regular heart rate, then more than likely you've got a sinus arrhythmia. And like I said, there are different types of sinus arrhythmias, but I think that's really beyond the scope of what we're hoping to achieve in this lesson. But certainly once you master identifying these basic arrhythmias, definitely look into some of these different things that are out there, because once you've been out there and you're on the floor and you're looking at these rhythms that your patients have, a lot of times you're going to come across things that you just don't quite know what it is, and you have to often think through it or grab a friend and kind of talk over what's going on and trying to figure out what's happening. All right, so now that we got that one out of the way, let's move on and start to talk about our premature beats that we're going to come across. And there's really 3 kinds of premature beats that we're going to see. And the first of these is what we call premature atrial complexes, or PACs as they'll often be referred to. And basically a PAC is exactly what it sounds like. Basically it's a premature beat that originates from the SA node, or essentially the atria. So in this example, this strip actually has 2 different PACs. The first one you'll find right here, and the next one you'll find right here. And essentially if you look at your strip, you can see normally we have our beats just trucking along right at a regular rate, and then all of a sudden here comes a beat sooner than we'd expect it to be. These are usually pretty easy to spot because typically you'll have that normal regular rate and rhythm, and then all of a sudden occasionally you'll have these beats that just seem to come a little bit earlier than you would expect them to be. Now these are often due to some sort of irritation of the atria, and so this leads to an increase in that automaticity of the atrial muscle tissue. Now a couple of our defining characteristics in order to really be able to identify this as a PAC are, first, it's going to have a narrow QRS. Next, you're going to have an upright P wave. And finally, you could possibly have a different morphology of that P wave. So we'll take a look at our rhythm on the strip here again. And all of these strips that we're going to show you are going to be in lead 2. And that's going to be particularly important because in order to identify a P wave being upright, we're going to need to know that we're looking at lead 2 to know that the P wave should be going up. So here we can see that we have our P wave, and it is in fact upright. We do have our narrow QRS complex, so we can check these off. And in this case, we actually do have a different morphology of the P wave when you compare it to the other ones over here. So again, if we look at this one at the beginning of the strip, this P wave has a different morphology than this P wave here. So in this case, we can check this one off too. Now, I wouldn't rely on this different morphology because sometimes they're going to look much like the normal P waves that you're seeing. But definitely if you have this on top of everything else, it should really help you easily identify that this is a PAC. All right, so the next premature beat that we're going to talk about is our premature junctional complex, or PJC. Now, we are going to talk about this, although one thing to know is this is a pretty rare thing. So it's not something that you're going to see very often as opposed to an actual junctional rhythm, which is something that we're going to talk about a little bit later in this lesson. But a PJC is not something that you're going to typically see very often, so we'll just kind of blow through this one pretty quick. On this strip, we really just have one example of a PJC, which is right here. And just like with the PAC, the PJC is going to be due to some sort of irritation of the AV junction. Now for the PJC, the first thing that we're going to have is another narrow QRS. But really the defining characteristic here is you either have an absent or inverted P wave. So if we go back and look at our strip, you can see we've got that narrow QRS complex. But if you look out here at a normal P wave, you see what we have going on here is this P wave is actually inverted. And like I said, it can either be inverted or sometimes you'll just see a flat isoelectric line before the R wave, but still having that narrow QRS, we can then identify this as a PJC. So moving on to the last premature complex that we're going to talk about, this is going to be our premature ventricular complex, or PVC. Now these are probably the most common one that you're going to see, and I think of the premature complexes, probably the easiest to identify. And so on this strip here, I'll go ahead and show you the PVC here. And just like with the others, I bet you can probably figure out this is often due to irritation of the ventricle, and these are typically benign. Now to really talk about the defining characteristics, the first and probably most notable is we're going to have a wide QRS complex. So as you can see here, this is a pretty wide complex that we have here. You're also going to notice that there's not going to be a P wave. Again, we've got nothing over here, which if we think about this is a beat that's originating from the ventricle, therefore you won't see a P wave because the signal didn't start in that SA node and work its way down. And then finally, when we talk about the T wave, we're typically going to have the T wave, which is going in the opposite direction of the R wave. So again, we have our R wave going this way and our T wave going this way. So we have that, we have no P wave and quite a wide QRS. Therefore, we can determine that this is a premature ventricular complex. Well, hopefully those made sense for you guys. I think identifying those premature beats in those different complexes is usually pretty easy. So next we're going to move on and talk about some of our basic bradycardic and tachycardic rhythms. And the first of these we're going to talk about is sinus bradycardia. And really the first defining characteristic of a sinus brady rhythm is that you're going to have a heart rate that's less than 60. So if you remember, 60 to 100 is our normal rhythm that we would expect in a sinus rhythm. And if we look at our strip here, we see we've got 1, 2, 3, 4 beats in a 6-second strip, meaning we have a heart rate of 40. Therefore, we're less than that normal range of 60 to 100, making this a bradycardia. Now, sometimes the sinus bradycardia can be a normal thing. A prime example of this is going to be our athletes. If you think about they've built up that strong cardiac muscle and have that real strong contraction and cardiac output, therefore the body just doesn't need to beat as often because you're going to get adequate perfusion as a result of that really strong heart. And so sometimes you'll see some bradycardia rhythms in these people. But this could also be a pathological thing. This could be something related to our nervous system, and that nervous system not telling the heart to speed up. This could also be the result of some sort of damage or disease. Think of things like sick sinus syndrome or just damage that results or disease processes that result over time in older people. And finally, this could be the result of some sort of medication. Prime example of this are our beta blockers, which if they've just happened to have too much of the beta blocker in them, this could cause their rate to slow down outside of the normal range. Like we had talked about, you're going to have a heart rate less than 60. In addition to that, you're going to have your narrow QRS and your upright P wave. We already identified our heart rate at being 40. See, we've got our narrow QRS here. And yep, that P wave is upright. Therefore, we meet all the criteria here, and we can identify this as a sinus bradycardia. Now, on to the flip side of sinus bradycardia. Next, we're going to talk about our sinus tachycardia. So once again, we know our normal heart rate is 60 to 100. Therefore, in order to have a sinus tachycardia, we're going to have a heart rate that's greater than 100. So in this example, we've got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14 beats in a 6-second strip, meaning we have a heart rate of 140, and that's definitely over 100. Typically, our causes for a sinus tachycardia is usually going to be the result of some sort of increased sympathetic response. So these can be things like your patient's in pain, they have a fever, they have an increased oxygen demand, or even things more serious like hypovolemia. Now, once again, we're calling this a sinus beat. Therefore, we're going to have that narrow QRS and, of course, an upright P wave. So again, if we look at our example, we do have that narrow QRS, and lo and behold, our P wave is upright. And we already talked about our heart rate of 140 is over 100. Therefore, we can say this is a sinus tachycardia. So moving deeper into the territory of our tachycardias, the next one we're going to talk about is our supraventricular tachycardia, or oftentimes you'll hear this one referred to as SVT. And really for SVT, our first defining characteristic is going to be a heart rate that is greater than 150. So in this example, if we count out these here, we see that we actually have 16 beats here. Therefore, we know we've got a heart rate of 160. So we are past that 150 mark, but sometimes with these SVTs, you can see rates as high as 300. Just crazy to think about. Now, you might really be thinking, how is this any different than a sinus tachycardia? Why do we have this distinction of 150? And typically the reason for that is at this point, you're going to end up with an indistinguishable P wave. And really what we mean by that is the rate is happening so fast that we can't really tell if this is the T wave or the P wave. Is there a P wave in there? Is there not? We can't really tell. But we can see that we have a narrow QRS, which you can see here, and therefore we know that this is coming from at least the AV node or higher, because those signals are going quickly through the ventricles, giving us that quick QRS complex. And that's where we get the name supraventricular from, is it's somewhere above the ventricle. But oftentimes we're just not able to tell because that rate is happening so fast. Finally, one last defining characteristic that you're going to have here is that you're going to have a pretty regular rhythm. There's going to be some fluctuation in it with its speed, but for the most part, you're going to be right around in the same area. And you can see that with our rhythm strip here. These R waves are coming at a pretty regular rate. Now, just to hit on the causes real quick, really the causes of our SVT are going to be very similar to sinus tachycardia, and it's primarily due to that increased sympathetic response. But here for this example, heart rate of 160 is greater than 150. Can't really tell if there's a P wave in there. We do have that narrow QRS and a regular rhythm. Therefore, we can say that this is a SVT. All right, I've always really kind of enjoyed those tachy rhythms, especially the SVT. It's pretty interesting when you actually see a patient that has that. And so with that said, I'm actually going to go ahead and stop this lesson at this point before this particular one gets too long. And to kind of conclude, in this lesson we talked about sinus arrhythmia, the 3 different types of premature complexes that you'll see in your patients, as well as the Brady and tachycardia rhythms that you're often going to see. And so in the next lesson, we're going to pick up where we left off, and we're going to talk about all the different atrial, junctional, and ventricular rhythms that are out there. And with that said, I truly want to thank you guys for watching. I hope that you found this lesson talking about some of the basic arrhythmias to be of benefit to you. And if you did, please go down below and leave us a like, because it really does help to support this video and the channel. And if you haven't already, please subscribe to the channel below as well. That way, as soon as our next lesson covering the atrial, junctional, and ventricular beats become available, that you'll get notified of that as well. In the meantime though, feel free to check out our most recent series of lessons, which we covered arterial blood gases. And so with that said, I want to thank you guys for watching, and we'll see you in the next lesson.